Welcome to the Parent Doctor podcast, where adults who are parents come to learn, lead with love, and grow. Hello, and welcome back to the Parent Doctor podcast. I'm your host, Dr. Marissa Caudill, child psychiatrist and mom of two, and I'm here to talk to you today about psychosis in kids and young adults. And this is one of the rarer reasons that someone would come to see me over the last 17 years that I've been in practice. But it's something that we do need to talk about because when it happens, it's really serious. And the earlier we can detect thought disorders and psychotic symptoms, the more effective our medications and treatments are at preventing continued symptoms and improving functioning. So my intention with today's episode is to make parents aware that although thought disorders like schizophrenia and schizoaffective disorder, or even depression with psychotic features, which can also happen, are quite rare. Less than 1% of the population will ever experience this. Nonetheless, they are very real illnesses, and we should trust our gut if our child's behavior is changing in a way that concerns us or that seems significant in adolescence especially. What matters here is knowing what to look for, and I'm going to go through with you what the negative and positive symptoms of psychosis are. And what's important today is making sure that if you have a child who's dealing with this, you take them to get assessed and treated as early as possible because, as I said, early treatment is associated with better response to medications and improved outcomes and functions. Before we get into all of that, I want to again remind you all, if you can, to please rate and subscribe to this podcast. That helps me move up the rankings and get listened to by more parents. And I know there's such a need out there for good mental health coverage for parents who have concerns about their kids' mental health. And as we all know, kids' mental health, especially depression and anxiety, is on the rise, and I want to empower you all to know how you can best prevent that and treat it if it happens, and support your kids if they're going through a hard time. You can find more about me at theparentdoctor.com. I offer a free newsletter, which you can sign up for there via email, and I also have a free monthly book club that happens on the third Wednesday each month at noon via Zoom, and it's broadcast on Facebook Live. This coming month in July 2024, we're going to be talking about a book called The Opposite of Spoiled by Ron Lieber. He's a money columnist for the New York Times, and the book is a really good one about how to raise kids to be responsible stewards of their money and to understand a lot about money. So it's a good one. All right, so shifting gears now and diving in, let's talk about what matters, and that is knowing what to look for. When we are thinking about kids who develop psychosis or thought disorders, we need to understand a few things. One is that the peak onset for both men or women is around late teens, early 20s, probably on average about age 20. For women, there's also a second peak. Yay, right? Great. Good news. But around age 50, there's a second peak of onset of psychotic symptoms for people who are going to develop schizophrenia. And that's thought to be due to the hormonal changes that happen around menopause. Women who are at increased risk for this, are women who may have had postpartum depression or psychosis or bipolar disorder. That doesn't mean that if you had postpartum depression or psychosis or bipolar disorder, you are for sure going to have a recurrence of symptoms in menopause. It just means it puts you at increased risk because your brain may be a brain that is susceptible to developing those symptoms when it experiences a sudden change in hormones, as happens in menopause. So negative symptoms basically refer to symptoms that we see in patients who have schizophrenia that are different than a neurotypical person. And that means negative, meaning they're missing. And these are known as the 5 A's of schizophrenia. The first A is affective flattening. That means just less emotional expression in one's face, in one's tone of voice, in one's words. Alogia, which is from the Latin, but it means impaired thinking that affects speech. So basically the lack of logic in one's speech. And then the other 3 A's are related to motivation and interest. And these are anhedonia, which is a long word, but it basically means less enjoyment and interest in activities that you previously found enjoyable. So just lacking life enjoyment. So hedonist, that word means enjoying life, right? Liking the good stuff. Anhedonia means the absence of that. Asociality is the 4th A, and this means reduced desire for social interactions, social withdrawal, basically. And then avolition is a lack of desire to do things. So again, it's hard, right? Because when we think about teenagers, Classically, we've all been told it's normal for teenagers to be moody and withdrawn and hormonal, but sometimes behavioral changes can indicate something more serious is going on. And the earlier we intervene for young people with thought disorders, the better. So I think if you have a child who's really significantly asocial, not wanting to do things, failing at school suddenly, and not even suddenly, this can be over the course of a year, can be like a long, drawn-out thing. And often it's mistaken as depression. But a good assessor will ask questions that will tease out the beginnings of a thought disorder. And often a person going through this will start to believe things that aren't true, start to have thoughts that maybe other people can read their minds or that they can put thoughts in their minds, bizarre beliefs like that. And they may start to be having some delusional thinking that they're not verbalizing. And this is why it's important, if you're concerned about your child, bring them to a child psychiatrist to get an evaluation, because it may not be exactly obvious on the surface, and you may make a false assumption that it's just your child being grumpy or moody, when in fact it could be something far more serious. The positive symptoms are harder to ignore, and these are basically symptoms in one's mind that shouldn't be there, like hearing voices when nobody's speaking. That's a hallucination, right? Seeing things that aren't there, that's also a hallucination. Delusions, beliefs that aren't true, disorganized speech, and either disorganized or even catatonic behavior. Catatonia is when someone assumes an unusual posture, like maybe their hands are raised or their arms are outstretched, and they can hold this for hours. Hours. It's called waxy flexibility, and it's part of various thought disorders like bipolar disorder and sometimes in schizophrenia. So those are all the symptoms that can occur and the reasons you should get early treatment. We know that there are some people who have increased risk. So let's talk about what are the risk factors for developing a psychotic illness. These include genetics. So if there's a parent or a first-degree relative who also has a psychotic disorder, then the child is at increased risk. It doesn't mean for sure that they're going to develop that. In fact, most children of a person with a psychotic disorder will not have a psychotic disorder by far, but it's still an increased risk versus someone who doesn't have a parent with schizophrenia or bipolar disorder. Trauma, and this can include either emotional trauma or physical trauma, like traumatic brain injury, can increase risk. Drug use or some medications can increase risk, and stressors. Now, those are broad terms, right? And again, most people who undergo a head injury are not going to develop psychosis. Most people who undergo a trauma are not going to develop psychosis. Most people who use substances are not going to develop psychosis. So it's always this interplay of nature versus nurture. It's a brain that was somehow susceptible, but then something happened and it just flipped that switch so that now these psychotic symptoms are developing. When we think about young people who are diagnosed with a psychotic illness, we know that early intervention and massive amounts of support to the child and the family are very important for outcomes. There are some researchers looking at young people who don't yet have psychotic symptoms and their risk for developing schizophrenia. And they have found that high doses of omega-3 fatty acids taken as supplements during this time in late adolescence may be protective to reduce the risk of developing a psychotic illness. But once psychosis has started, once those symptoms are there, either negative symptoms or positive symptoms, then treatment with an antipsychotic medication is necessary. And to this end, the National Institutes of Health is running a program called RAISE, and another one called EpiNet. I'm going to put the links to those in the show notes so that you could, if you were worried about your child, look into clinics in your area where they are doing these protocols and offering families support. But basically, both of these are attempts to create effective community-based coordinated specialty care, which is a recovery-oriented team approach to treating early psychosis that promotes easy access to care and shared decision-making among specialists, the person experiencing the psychosis and their family members, because ultimately it's even more important than ever that for a young adult with schizophrenia or psychotic symptoms that they have family support and that there are caregivers and care partners within the healthcare treatment team who are helping the parents navigate that, because inevitably it's a bit difficult oftentimes, right? You have a young person who's trying to differentiate, go out on their own, become independent from their parents, and at the same time, unfortunately, at this very difficult time in life, they're dealing with something that's making them temporarily more dependent on their parents and needing more support from their parents. And that's a tricky thing to navigate, and that's where case managers and social workers can be really helpful. The coordinated specialty care that is delivered in these clinics involves individual and/or group psychotherapy, family support and education programs, medication management, which is really key, because again, the earlier a person with early onset psychosis gets treated, the better their outcomes long term, and then supported employment and education services, as well as case management. All right, so in my past episodes, I've talked about spirituality, and I've talked to you all about my hypothesis that basically all mental illness develops from overactivation of the fear parts of our brain, the downstairs, lower, more primitive parts of our brain, the parts of our brain that are more evolutionarily conserved, the parts of our brain that are primarily concerned with keeping us alive. And you can see that if that part of your brain were inappropriately active, it would lead to symptoms that look a lot like psychotic symptoms, right? It would look like paranoia. It would look like social withdrawal because you would be in protection mode. You would be in that fight, freeze, flee, fawn mode. And when we think about all mental illness, all the reasons that someone comes to see a psychiatrist, whether it be a child psychiatrist or an adult psychiatrist, I think most of the time, spirituality in terms of connecting to something greater than ourselves, recognizing that although our brain might be doing all kinds of things, might be sending all kinds of messages and automatic negative thoughts and causing us to feel emotionally bad, we ultimately are separate from our brain. We are not our brain. We are not our body. We are the observers of our brain and our thoughts and our emotional state, and we're separate from it. And I think in a healthy person, developing that spirituality, we know it's very key to reducing symptoms of mental illness. When it comes to a serious mental illness, though, like bipolar disorder, which I talked about last time, or schizophrenia, which we're talking about today, or schizoaffective disorder, is it possible for a person who has severe schizophrenia to benefit from what I'm talking about, like a connection and a belief that they are not their thoughts? My answer here is I don't know. I want to believe that it's true for everyone, but truthfully, having treated people with severe thought disorders, it's hard for me to imagine that when a person is in that place, they're really locked into their brain. And although I know they still have a soul and they still have a true self and they still have consciousness, accessing that and connecting with that within them is very difficult when the brain is so holding the wheel of their consciousness and the paranoid thoughts are so driving their behaviors. I think here, when we're talking about spirituality, what's really important is if you love someone, if you have a family member or a friend who has a psychotic illness, if you have a child with a psychotic illness, the spiritual piece is going to be very important for you, because connecting to your own true self and recognizing that the person you love who's dealing with this mental illness has a true self too, has a soul, has a spirit, whatever you want to call it, but recognizing that your spirit can't control their bodily actions, their thoughts, their behaviors, and can only try to connect on a spiritual level to this other person by loving them, by providing a non-judgmental relationship, by supporting them in every way that you can, by giving them space when they need space, by respecting their need to have autonomy and make choices, but at the same time, by doing everything you can to keep them safe. And that's a tough road to walk, and it requires a lot of support. Again, I'm going to recommend that if you're in this situation and you're supporting someone who has a mental health illness like schizophrenia or schizoaffective disorder, that you seek support in your community from other people going through the same thing through an organization such as NAMI, National Alliance of Mental Illness. And I'll put that in the description today so that you have that website again. I'm also going to put in there a link to the National Institutes of Health RAISE program, as well as the EpiNet program that I was speaking about, and a PDF document link that is all about understanding psychosis for families and young people who may be dealing with this. All right, so that's basically what I wanted to talk about today when it comes to psychosis. I don't know if I would say bipolar or psychotic disorders are hardest, but these are definitely, as a psychiatrist having treated thousands of patients, these are definitely the illnesses that are the hardest to deal with, because the ability to function in your best way when your brain is telling you all kinds of things that aren't true or delivering sights or sounds that aren't really there, it's hard for us to even imagine if we've never experienced that. But of course, it would be very difficult to then just go about your day, go to a job, have coffee with a friend, whatever it is, right? There's so much going on in one's brain that's busy keeping the survival part of the brain, the part of the brain that's trying to keep you safe, busy and occupied, that everything else goes offline. It becomes very hard to do anything else, to read a book, to write an email, to take a shower. All of those other things seem secondarily important compared to the threats that one is perceiving to be coming in, even though they're not there. So it really is a way that the signals within the brain, the biology of the brain is broken temporarily. And the medications that we have, they're pretty good at treating the positive symptoms, like taking away delusions and hallucinations and reducing paranoia. The challenge really becomes the side effects of those medications because, as we talked about before, these can include sedation, dry mouth, tardive dyskinesia, weight gain, diabetes, all those things. So they're not easy medications to take. And then even within that, they are not good at treating negative symptoms. So the hard part is that for people who have prominent negative symptoms as part of their psychotic illness, that affective flattening, alogia, like impaired logical thinking, anhedonia, like a lack of interest and joy from things, not antisocial, but asocial behavior, like not wanting to interact that much with other people, and abolition, just not having motivation to do much of anything. The negative symptoms, we don't yet have pharmacological tools or medications that are very good at helping that. And that's so hard because if you knew the person before they developed psychosis, they become a very different version of themselves after the psychosis if they have prominent negative symptomatology. And so then it becomes really caring for someone who has a significant disability. And that's, of course, both hard work and heartbreaking if that's someone that you love. And yeah, this is a tough part of psychiatry, a tough part of mental health care, but it's real. We need to know that it exists. And if you have a child who is in their teenage years and you are worried that their behavior or their thoughts or anything just seems a little bit bizarre or a little bit out of the norm, trust your gut. I would far prefer that more parents err on the side of caution and bring their kids in just saying, like, I hope it's nothing. It's probably nothing, but I just would like you to have a conversation with my kid and see if you think there's something going on, because in my clinical experience, it was almost always the opposite. It would usually be classically a young male patient. And when I got the story from the family, it was like this slow progression over the course of 6 to 12 months where this young man had gone from being an athlete, a good student, whatever, hanging out with his friends, to not wanting to leave his room, not wanting to shower, would come in with like long fingernails, body odor. And then when I would start asking questions, it was obvious that this young person had developed a pretty severe thought disorder and was having some positive symptoms of psychosis as well. So yeah, this is a tough thing to go through as a family. My heart goes out to you if any of you are dealing with that now. It's something that I would love to talk to families about in future episodes. So if you yourself ever went through psychotic symptoms and recovered from them, or if you had a sibling or a child who went through this, or if you're going through it right now, if you'd be interested in talking about your experience, what's worked for you and what hasn't, how you're coping, what's been helpful in the mental health services that you've received and what hasn't been, all of those things. If you'd like to join me on a future podcast episode, then please send me a message at hello@theparentdoctor.com or via my website, theparentdoctor.com. All right, guys, I will see you next time, which is going to be episode 11. That is going to be about OCD, and that's going to be our final clinical episode of this season. I will have one more episode after that, kind of wrapping up season 1. And then we might take a little break because I'm on summer break with my kids, and I'll come back with season 2 where I'm going to be interviewing people and talking about various topics of interest to parents. This first season I really just made as a reference. So I want you all to have tools about specific mental health diagnoses and resources that you can use. And that's what this first season is all about. So I hope that you found today's episode helpful, although I also hope that you don't find it helpful, that you have no connection to anyone with psychosis. That would be great for you and for everyone you know as well. It's a really tough illness. But if you are going through it, I want you to know you are not alone. There are effective medications. There are new medications all the time. I have a lot of hope that things are going to get better and better. And yeah, there are a lot of people who do very well when they're on their medications. Some of them include people who are functional attorneys. And I'll put some resources and books in there as well so that you can hear about those wonderful stories. All right, take care. Talk to you soon. Bye.